First, why is proton therapy at all different? If you're not familiar with it, and I try to take it back to the simple version of it, but protons can stop. That's the simple word. So X-rays go through and through our bodies, inside in one side and out the other. So I always tell patients, if your tumor's right here, I'm going to put 180 flashlights around it and shine them all at your tumor. Now, on your tumor, it's going to be very bright, but in all the surrounding tissues, both on the proximal side and the distal side of your tumor, there's going to be light that unfortunately goes into your normal tissues and causes the significant side effects that are associated with our therapy. Protons instead can go to a certain depth. They enter at a low dose and they peak suddenly and drop off with no exit dose on the other side. So it allows us to basically give no dose to the distal tissues and to reduce dose to the proximal tissues, hopefully improving outcomes. Now, what does that mean for patients? In some diseases where we did not have as good cure rates with X-rays, those are pretty rare diseases, not most head and neck cancers, but there are some of them. We can actually escalate the dose with protons safely and therefore hopefully get higher cure rates. And in some diseases that is shown to be the case. In the head and neck space, that's particularly true for nasopharyngeal cancers, ones at the top of the back of the nose, ones in the paranasal sinuses, which often happen between and close to a lot of critical structures in our vision and eyes, and near our brainstem. And those in the base of skull are salivary glands crawling up into the base of skull along nerves. Those are common utilizations for proton therapy these days in the UK as well as in the United States. They are very proven in both prospective data as well as retrospective data, and a lot of patients are eligible for that currently, both on the NHS as well as private insurances or self-pay patients, and patients come from abroad also into our service at Proton International London to be treated in London with proton therapy if their home countries don't have it. Those are obvious wins for the proton therapy space and for the head and neck cancer space. But the question that's been asked in more recent years is for patients where we do get great cure rates. For example, oropharyngeal cancers, which is the most common type of head and neck cancer, especially in the developed world, the back of the tongue, the tonsil, those surrounding areas. Can proton therapy make a difference in not cure rates, because cure rates are actually very high for that disease these days, in the 80s to 90% range, but can we reduce the side effects associated with our radiotherapy? And I do not take it at all lightly that when I treat patients, I say, hey, you're gonna have a very high cure rate. That's a win for the field, it's a win for you. But I take very seriously that I cause a lot of side effects that last patients decades because they are cured of their disease. They will live 20, 30, 40 years with the ramifications from my therapy. And so whatever we can do to reduce that has been a priority in recent years.